Hello, everyone. Welcome back to Neuroscintilla Insights, where we really unpack practical, evidence based strategies for complex neurocare. I'm Dr. Scott Haggerty, and today we're elevating our laser therapy game in a big way. If you are already using brain laser in your practice, or also known as transcranial photobiomodulation in practice, or curious how to integrate it with greater precision and depth, you're very much in the right place because we're going to dive very deep today. We'll explore the full arc of photobiomodulation from photon absorption to lasting patient outcomes with conversational insights you can implement nearly immediately into your practice. Before we get into specifics, let's set context. So, first, why is brain laser such a pivotal tool for clinicians who are working with cases like autism, ADHD, stroke, TBI, and neurodegenerative diseases? Well, also, you have to ask yourself, what unmet needs does it address that traditional therapies miss, right? So let's dive in here so we can unpack this. In my many years of treating complex neurological conditions, I have noticed three persistent brain-based bottlenecks. Number one, cellular energy deficits. What does the brain need to be healthy? Blood flow, energy stimulation. When neurons are starved for ATP, they struggle with repair and rewiring. This is like Neuro 101. Then a chronic inflammatory state, right? You get the microglia stuck in overdrive, which can really worsen the injury, the problems, the symptoms, and create an ongoing cascade that can begin to fire itself over and over and over again. And then dysregulated brain rhythms. If you know anything about brain rhythms, and in particular brainwave entrainment, this becomes a big issue because aberrant oscillations really undermine cognition, growth, development, movement, and so on. These bottlenecks will keep patients stuck. And what brain laser does differently than other things is it tackles all three of these at once. It recharges the mitochondria, it recalibrates the immune response, and it resynchronizes neural circuits. And this is a huge thing. You'll never find anything out there right now that's able to tackle these three things at once and have these kind of profound effects. In other words, it primes the brain to respond to your therapies more effectively. So the work that you're doing, you're going to upregulate your results by implementing this. Now, let's take a look and see how this works at a cellular level. And if you want more of the details, the newsletter this week has this broken down in depth. I'm going to give you an in-depth but kind of high-level overview of this, because understanding why really sets the stage. We need to dig into some of the cellular mechanisms here, especially when it comes to the mitochondria, so you understand what's happening. At the core of brain laser is cytochrome C oxidase. It's the enzyme that sits at complex 4 of the electron transport chain. And here's what happens. So specific wavelengths in the range of 650 to 1,000 nanometers excite the heme and copper centers in CCO and driving electron transfer. And O release then, so near infrareds from 800 to 830 nanometers remove bound nitric oxide, which normally act as a brake on respiration. In practice, when you do brain laser, you might see a 30% jump immediately in oxygen consumption in underactive cortical regions, like the prefrontal cortex, for example, in ADHD within just minutes. Doses of as low as 3 joules per centimeter squared with an 810 nanometer treatment. They've done numerous studies on these, like things like PET scans and whatnot to map hypometabolic zones and to confirm this engagement. With freeing up CCO, right, neurons are ready to ramp up their ATP production, which becomes a big deal, because what you then need to do is you need to examine that this energy surge happens and why it's a game changer for therapy timing. So when we talk about reactive oxygen species, it's often misunderstood as purely being damaging, and that's not entirely the case. By generating a mild controlled burst of reactive oxygen species, we can activate key transcription factors and antioxidants without tipping into oxidative stress. This approach brings inflammation down from a roaring inferno to a managed constructive spark, which becomes huge. Clinically, this translates scheduling your most intensive tasks like speech exercises, motor training, cognitive drills. Ideally, you want to begin them within the first 10 to 45 minutes after the brain laser therapy has been done. Research shows a 50% boost in learning and recovery efficiency during this window. And it doesn't take a lot. I mean, you're talking a quick 3 to 5 minute primer. You could go through and just do a short burst of laser on the brain, and you're going to see an uptick in the way that the brain performs doing this. When you dive into doing higher power, like what we do with our class 4 lasers, what you get is a much bigger level of activity, which leads to much bigger and faster changes. That's why when we started diving into doing a lot of the work, the class 3 stuff had already been there, but what we've seen with using class 4 has just been unbelievable because you're really able to go and drive deeper activation in the brain. And so let's keep moving here, because when we start really kind of covering how brain laser orchestrates this controlled oxidative signaling to modulate inflammation and promote repair, it begins a cascade of things. Because what then happens is that brain laser generates this mild burst of reactive oxygen species, and it's a targeted alarm signal. So clinically, what's happening is it's activating multiple different pathways in the inflammatory cascades, helping the brain to be able to respond more appropriately to inflammation. So clinically, this translates to reductions in things like interleukin and tumor necrosis factor by up to 40% in CSF, especially, and this is relevant for things like PTSD, concussion, and long COVID patients. And to maintain optimal levels of reactive oxygen species signaling without overloading, one of the things that you can do is you could even do split doses. Things like 2 times 2.5 joules per centimeter squared with a short rest. It's inflammation control with precision healthcare/medical principles and scientific research behind it. Now that we've kind of set the stage at the molecular level, right? And I know we're kind of moving through a lot. Let's see how these signals translate into actual circuit changes within the brain, because all the science is great, and understanding at what's happening at a neuro and cellular level becomes important. But what really becomes relevant is that we're going to make changes in brain plasticity that drive long-term change. So far, we've powered up cells and sent out precise repair signals. But how do we translate that into new brain circuits? Well, that's where neuroplasticity cascades come into play. Picture a cascade of molecular events, BDNF surges, CREB phosphorylation, dendritic spine growth, creating the scaffolding for lasting change and really driving this process. Understanding these cascades allows us to schedule therapies not just for effect, but for maximum neurostructural impact. With energy and signaling optimized, brain laser kicks off neuroplasticity cascades that really start to bring this whole thing together. When you get a BDNF surge, right, you get peaks 1 to 3 hours post-treatment, promoting dendritic spine formation. This is brain growth. This is a big deal. You get CREB phosphorylation, which locks in long-term potentiation and lasting synaptic changes. So long-term, and axonal sprouting. So now this encourages new pathway formation. That is massive. And this has been demonstrated, especially in things like chronic stroke models with repeated protocols. So you're seeing these things modeled even in the most complex, most difficult, most traumatized neurological patients. So imagine what's happening in people who are healthy individuals. So in clinic, what I oftentimes will recommend doing is aligning intensive therapies, right? So if we have patients that are doing things like physical therapy, speech, or other forms of cognitive rehab, what we want them to do is to try and line them up as close as possible to when we're doing our adjustments and our laser therapies, so that we're going to be able to see accelerated functional gains. So we try and keep these things really kind of lined up as close as possible. It's like pairing a rocket booster with your rehab exercises. Now, we know that obviously when we're diving into these types of things, structural remodeling is vital, but function depends upon timing. So let's talk about syncing light pulses with the brain's rhythms, because this whole thing obviously with the cellular mechanisms becomes important. But if you're not really thinking about working with brainwave patterns and brain entrainments, then you're missing an enormous piece of how you can influence the brain to function optimally. And we dive deep into this in a lot of the articles, and I'm going to expand upon this, because if you don't work in neurofeedback, you're not familiar with brainwave patterns, this is going to be critical for you. So we've talked cells and circuits. So let's tune the symphony now using things like brain entrainments. So frequency entrainment uses pulsed light to sync up with the brain's natural rhythms, amplifying healthy oscillations and dampening pathological ones. Entrainment bridges the gap between molecular change and functional outcomes, helping patients regain focus, memory, and motor control by literally guiding neurons to fire together in harmony. That's huge. Like, let's restate that. Entrainment bridges the gap between molecular changes and functional outcomes, helping patients regain focus, memory, and motor control by literally guiding neurons to fire together in harmony. That is massive. Continuous light's great, like, and if you have a laser that does that, but pulse light at specific frequencies lets us entrain brain waves. And this is huge. So if you're doing laser, this really is where the magic sauce comes in, because not only can you influence the cellular changes by hitting them with the 810 or whatever frequencies you're using, what you can do is you can change the oscillation patterns. So if you're in neurofeedback, you know about this, right? The importance of brain entrainments, these patterns becomes huge. So let's take, for example, if we set the laser so it's going to be at an alpha wave pulse at around 10 hertz. So what it's going to do, it's going to help to enhance sustained attention and calm hyperactivity. If we set a theta pattern, say around 6 hertz, then this is going to boost memory encoding. And this is perfect for patients that have TBIs and are in the process of doing learning tasks. Or if you've got someone who, let's say, for example, if we need to go and put in like a beta, which is going to be around 20 hertz, this is going to increase motor cortex excitability. And this is amazing for patients with Parkinson's and other types of motor deficits and issues with hyperexcitability in the brain where they need activation. Or if you're doing, say, gamma patterns where around 40 hertz, what this is going to do is this is going to help to support amyloid clearance in Alzheimer's. And guys, when we talk about all this stuff, just so you have reference, this is all research documented. This isn't me thinking this. These are all proven things that when I was diving into all of this work, this is research that's been documented that shows these changes in brain tissue. And so, if you use EEGs, right, make sure you're always pairing EEG monitoring to confirm increases in these target bands. This is a big piece of how you can help. Now, obviously, not everyone does EEGs, and so what we'll do is we'll lay out for you things that you can use, because if you have patients with certain types of neurological or neurodevelopmental conditions, one of the things that has been proven is that there tends to be pretty consistent characteristic patterns the brain takes on. So even if you're not using EEGs in your practice, we can give you things that you can work with to make assumptions about what the brain is doing. So you can use patterns to try and entrain the brain so it performs more like it's supposed to. And so now that we've dove into this, and in the newsletter, we're going to dive much deeper. And in issues of the newsletter and in episodes here, we're going to dive much deeper into these. But I want to keep moving. So when we've synced up the rhythm, we need to extend that window of plasticity. And in particular, how do we do this? So imagine if you could double the time that your patient's brain stays in prime condition for learning and repair. That's exactly what split dose and entrainment protocols will achieve. By strategically spacing a continuous dose and pulse dose, we extend the biochemical and electrophysiological readiness far beyond the usual 1 hour window. Then by layering in a cutting edge tech like binaural beats, vibrotactile feedback, live imaging, we can make every minute count by continuously adding in stimulus to make that window longer. So to stretch our plasticity window from 1 to 2 hours, and see, for example, use split dose and entrainment approach. You can use things like, for example, if you're setting the laser, you would prime the brain using a continuous dose, 810 nanometers at around 3 joules per centimeter squared for 5 minutes. Give the brain a period of rest, 10 minutes, so you get that peak in ATP and reactive oxygen species. And then you come back in after 10 minutes and you do a pulse at 10 hertz, 810 still. So you're getting that effect of the brain entrainment at 2 joules per centimeter squared for 5 more minutes. What you're going to get is you're going to get the brain making this big transition so that you're going to have this really big theta spike, or excuse me, so you're going to get this really big alpha spike. And so now the brain is going to be in alpha and it's ready to go and do the hard work, and it's going to be primed. So then what we do is we can layer on supportive tech, right? You can use BrainTap. Now, so BrainTap, if you're not familiar with this, BrainTap has specific types of visualization programs for function. Now, you can do those, or you can go into the app and you can use things like they have a brain training section. So what you can do is you can go into the BrainTap brain training section, then you can do a 6 hertz theta session to pair with it. If you wear an Apollo neuro bracelet, then you can do things like they've got things for like focus, where it beats at an alpha frequency, and this alpha frequency will help to go in and train the brain further. And then you have different types of wearable devices that you can find out on the market as well to get things like live hemodynamic and oscillatory feedback. But really, two very easy ones are Brain Tap and Apollo neural bracelets. This synergy helps to go and transform brain laser into a precision guided neural rehab platform when you start doing things to extend this window. So now let's take a few of these things and start to put them all together. Theory is great, but what does this look like in your clinic? So let's walk through some of the blueprints here that you can share with your team and your patients. These aren't just like numbers on a page; they're step by step narratives designed for real world sessions to help you communicate clearly and confidently. So here's how I describe these protocols when we talk to patients. Right. So when you're talking about a patient that's on the spectrum, what we're going to do is we're going to talk with the parents of the child about putting these doses together in a strategic manner so that we're going to be able to get maximum benefit. And what I'll do is just very simply is I'll explain to them. We're going to use the laser wand. We're going to target these specific areas of the brain that are relevant to where they're working with, right? So if you've got a child who's on the spectrum, you're going to always want to go after the frontal lobe. It needs stimulus because that's an area that is going to be dysregulated. If they're having issues with things like speech, you're going to go and target Broca's and Wernicke's. If you're going to help with things like some of the emotional dysregulation, you'll go through things like targeting the areas like in the temporal lobe to go and reach temporal lobe and amygdala. If they're doing things like, say, for example, they're pairing it with speech work, right? Then what we'll want to have them do is go to their speech therapy appointments immediately afterwards, so they're going to be able to get the benefits. If mom and dad are going to do exercises with them in your office, then what you do is you pair the two things together very closely. You have them do their dosing with the laser. Once they get done with doing that, then they go through and they start doing things where they're doing exercise on social skills or speech or role plays or eye contact activities to go and leverage that plasticity window because you want to continue to extend it. So if you're working with a child who's got ADHD, right? So you have to look at what do you need to do? So you're going to apply the laser over the right dorsolateral prefrontal cortex. You're going to pulse it at 10 hertz to entrain the alpha rhythms. And then you're going to have them do things like attention drills. And that can be simple things like doing eye tracking movements. You can have them do things like if you do interactive metronomes in your office, if you do neural feedback, pair them together, right? You've got the brain in this prime state. Take advantage of it. If you're working with neurodegenerative patients, like patients with chronic stroke, then you'll want to go and split up a dose, like a 5 joules per centimeter squared, 810 nanometer dose over the perilesional cortex, and follow each pulse with a targeted speech or motor therapy during ATP peaks. So you're taking advantage of the brain's ability to go and respond at its max during these open windows. If you have, say, for example, someone who's dealing with depression, then you're going to do a 4 joules per centimeter squared treatment over the left prefrontal cortex. And you're going to immediately pair that with some other type of a therapy. Sometimes some people do like cognitive behavioral therapies to harness this metabolic window. I will tell you that, you can go after a couple of different areas when you start dealing with depression. You can do, obviously left prefrontal cortex, but you can also go after the amygdala. You can stimulate the vagus. You can even do stimulation directly over the cerebellum to really kind of take all these integration centers, because it's never just necessarily one area that's going to benefit from being helped when you're dealing with conditions like anxiety and depression. So early Alzheimer's patients too, right? You can pair an 810 nanometer, 3 joules per centimeter squared pulse at 40 hertz, accompanied by doing things like word association, memory tasks. And you can do this, 1 to 3 hours post laser treatment to get a really big BDNF surge. Long COVID patients who are dealing with brain fog, you can help them by doing things like a single dose 810 nanometer at 3 joules per centimeter squared over prefrontal areas, followed by light aerobic activity to consolidate their ATP driven gains. You always want to tailor the program to what each patient needs, thinking clinically about what areas of the brain need to be stimulated, how do we need to stimulate them, what do we need to pair with it to get the maximum benefit. And obviously, there's other things that we could be integrating things like nutrition, other forms of exercise. cardiovascular exercises to maximize these things. There's lots, but just kind of giving you an overview. And any clinician knows that real world practice isn't static. It requires ongoing refinement, which is why we're talking about this. That's why if you have the ability, you can get into advanced monitoring frameworks by combining things like functional imaging. You can go after serum biomarkers and standardized scales. Any of these things can be adapted into your practice because obviously we're concerned about getting maximum results. So if you want to get into more specific outcome driven things, where you want to do EEG mapping, if you want to do blood work, if you want to really like look at how you can maximize a lot of your benefits, start trying to find ways that in your practice that are congruent with your model that allow you to really be able to monitor the gains that you're making, right? If you're using standardized testing, that's easy, right? You're going to be able to go and see standardized gains. If you're doing things like, you know, neurofeedback in your practice, you're going to see very, more rapid EEG changes than what you're used to. If you are, working with other therapists, the therapists are going to report back to you rapid increases in speech gains and emotional regulation and cognitive gains and physical gains and motor control gains. So you'll get this feedback loop that's going to help you to understand your effectiveness and be able to go and see the way that you're changing things. One of the big things you have to keep in mind too is that you want to really periodize for sustained gains because to cement the benefits of brain laser, we need to borrow a page from what they do in sports science, and we use what's called periodization. Rather than a flat schedule, we want to really structure the treatments into phases. They need to be intensive phases where they're more aggressive in the beginning, then consolidation phases and maintenance phases, each with specific goals and metrics. This approach ensures that we build momentum and then solidify the gains for the long haul. And the severity of the patient's symptoms are going to drive the frequency which are required. I really recommend that you look at doing this because if you're not used to doing periodization of the programs, you're missing the boat. So, depending upon severity, you want to look at doing an intensive phase. And that can be, 3 sessions per week, combining split dose, entrainment, adjunct tech, targeted therapies, whatever. And then once you get through that initial window of the more intensive, then you take them into a 2 session per week program, again with integrated therapies and tech support to keep the brain moving in the right direction, to keep it becoming more and more healthy and expanding these windows. And then what you do is, depending upon what their condition is and what their needs are, you may want to consider a maintenance phase where they're getting 1 session a week or 2 sessions per week based upon the severity. Obviously, if you're talking about a kid who's got ADHD versus an adult with Parkinson's or Alzheimer's, you're talking about two entirely different outcomes. You're looking to try and extend the window of health for the brain in the person who's got Parkinson's or Alzheimer's to give them the longest possible improvements in their quality of life. So that may require a more intensive maintenance phase where you may need to keep them at 2 times per week indefinitely. But if you've got a kid who has ADHD and you can see that there are all these tangible changes, well, then you're probably going to want to take them down to lower dosing and where you maybe do 1 session per week to keep the brain moving in the right direction and pairing it with things like neurofeedback. Or you may have them doing daily Apollo neuro sessions, or you may have them doing once or twice per day doing a brain tap. Whatever fits your model, whatever you're comfortable working with, make sure that you're finding the appropriate pairing to maximize the changes in the brain. This becomes huge. So, hope this gave you a good understanding of what you can do to expand your clinical expertise, how you can expand the window of neuroplasticity, and how you can really uplevel your gains with your patients. So, first and foremost, I really want to thank you for joining this clinician-focused deep dive on advanced brain laser therapy protocols. For full details, citations, planning tools, visit neuroscintilla.substack.com and subscribe. I would love to get your feedback. I would love your comments. I would love your questions because that'll help me to go and guide how we want to continue to create content for you moving forward. Because this is why I do this. I want every clinician to implement brain laser in their practice because the gains that you'll see and what you can do for patients is going to be unbelievable. The more you learn about this, it's like a Pandora's box. You don't know what you're capable of helping until you start doing this, but everything you do will get better as a result of this, I promise you. So guys, I'm Dr. Scott Haggerty. Help me grow this mission, shine light, build plasticity, and transform patient care just one pulse at a time. All right, guys. So thank you so much for your time. God bless each and every one of you. And I will look forward to seeing you in the next one.